Okay, welcome back to our next session on facilities and safety. It's a little short section. I just want to remind you to make sure that you are doing your facilities checklist um, two times two times a day for Head Start and 3 times a day for early Head Start. It is your responsibility to make sure that we are providing a safe environment for our children. Make sure that you are staying in ratio with our children to caregivers. Make sure all the equipment works properly. There's no broken pieces in the classroom. Making sure all the medication is properly labeled, locked and up out of reach of children. Make sure that when the children are eating, they're eating at the designated in the designated areas for eating. Making sure that when you're changing diapers, that you're doing it in the appropriate area. So those are some of the things you want to make sure. If you have breast milk, that it's being properly stored, and making sure the refrigerator is being kept at the appropriate temperature. So those are some of the things that you will be doing on a daily basis, 2 to 3 times a day. Again, making sure that the equipment is working properly for our kids and providing that safe place for our children. Next slide. This is the hat that I talked about in one of our earlier sessions, the health assessment tool, where we actually come out and check your classroom to make sure it is safe for the child, making sure that you have extra gloves in the classroom, make sure that your first aid bags are properly stocked, making sure that you have your emergency contacts in your first aid bags, up-to-date contact sheets for every child, making sure that your flashlights are there and that you have batteries in them and that they are working properly. Again, double checking to make sure that that medication is locked and stored and up out of reach of children. Making sure everybody's been trained on CPR and first aid and universal precautions. Make sure that all of your personal equipment, your personal belongings, your purse, your coat, so on and so forth, is in a locked area, okay? So that no one can get into that information. Making sure that you're up to date on your TB and your TDAP. These are some of the things that we look for when we come out and do your hat. We also make sure that your team assignments is posted in the appropriate place and that all your posters is posted in the appropriate place. In one of the slides to come, we'll show you what that looks like. Okay. Again, I can't reiterate it enough. Making sure that you have that medication locked and up out of reach from all children. Making sure that that water is easily accessible and ready, available to children at all times. You're wearing your first aid kits every time you go out of the room with a child. Making sure you do your daily and weekly checklist, and then making sure your posters are posted in the appropriate place. Okay, so those are the things that we look for when we come out. And we talked about those safety caps, making sure that the electrical outlets are covered with those safety caps. All right, make sure you have your emergency contact information posted by your landline. Okay, all landlines have to have emergency contacts, and this is what needs to be on there. You need your director, your program manager, family and community specialist, your program manager. You need all their phone numbers. You need 911, the ambulance, the non-emergency phone number, poison control. So this form is pretty much self-explanatory. Please read it over and make sure you have that information posted by your landline. If you are in Elkhart, you want the nearest Elkhart hospital. If you are in St. Joe County, you want the nearest St. Joe County hospital, okay? So keep that in mind as you are putting your emergency contacts list together. Next slide, please. All right, again, this is emergency contact list that you want to have. This is your poster board. This is the information that needs to be posted on your poster board. So you have your hand wash, and we'll give you a list of those posters. You may not be able to read all of them from this slide, but we do give you a list of all the posters that you need to post in your room. And this is what this is. Some staff members like to post the posters in order or according to the list that you're given. They just post it in that order, which makes it a lot easier for us when we come into your room to do your hat or your assessment. Also remember that in the kitchen, your kitchen posters goes in the kitchen. It should not be a diaper changing poster posted in your kitchen. In your kitchen is your 3 envelopes, your food restriction, your health conditions form, and your rejected medication forms, okay? Rejected medications is medications that have been brought to school and we do not have the proper paperwork to administer that medication. There's envelopes inside of here. You would take it out of here, you stick it inside of an envelope, and then you would lock it in a locked area that is rejected. In other words, we don't have the proper documentation to give that medication, okay? And again, I'm just going to reiterate that emergency contact list. You need your director. You need the person that's in charge in your building, because maybe you're in a building that has a principal. Their name and number needs to be on that emergency contact list. Your site manager needs to be on there. Your family and community specialist name and number. Again, the non-emergency as well as 911. The ambulance, poison control needs to be on there. Child Protective Services, the 1-800 numbers, all of them are listed in your handouts. The child care hotline information number, my number, and then you should also have my co-partner DNL's number, okay? So those numbers need to be intact and easily available. And then you also need emergency contact sheets of all of your students placed by the landline as well, okay? So we're going to take a pause here and move on to our next section.